Dear Creator, we're thankful that we are all here assembled with the Commission on HIV as activists, as community members, as people who care and who help out with the community through their volunteering and through their work, and for those providers that give us the care that we need, and for the LGBT centers and for APLA, AHF, and all of these organizations that help us. We're thankful for these people. We're also thankful that we are here on Tongva land, and this is the land of the ancestors of the people that are here, that were here in Los Angeles. And as we go through this meeting, please help us to open up our minds and to create the conversation that will create more thought-provoking, give us more tools, and give us assets to help our community members here and within our tribal elements, including our reservations, the family members, and our community members who are there as well, and also to give us tools that we can also help our community as a whole. And this is a planning session, so we're thankful to be here, and we're thankful to be invited and to be able to have a say at the table today. And so we're very cognizant of that. And also, as we leave this, remember that we need to also enjoy our lives and to enjoy what we do for a living, and to do what we do in order to help the greater community around us and to create our livelihoods as well. And it is our hope that we as people make everything better for the next generations, the generations to follow, and also the present day that we live in, and also the life that we live today. And so let us remember to have joy, happiness, and confidence and peace in front of us, behind us, below us, and all around us. Thank you.
Let's see. Good morning. I see the other panelists just arrived. Gabriel? Nick of time. Thank you for this opportunity. I think we have until exactly what time? 10:20, 10:30-ish? Okay. Well, I'll mention as framework before we get into the nitty-gritty and enhance our introductions, and before I speak to our panelists, that the explicit purpose of this panel is to discuss the impact of HIV/AIDS and HIV-related disparities and stigma within the Native and Indigenous communities, and what the community can do to support Native and Indigenous communities. That said, I'm honored to be moderating this panel. One of the panelists could not be here, Storm Salazar, and I'm thankful that Michelle Enfield, former commissioner, was able to bring us together. We're but a small representation of the many tribal entities within the Los Angeles County Basin. So we will do our best to represent. It's daunting for me to be back here. I was a commissioner some 15 plus years ago. It's nice to see you, Bradley and Al, and there are probably a couple more faces I don't. Hi, good morning. Saw Susan. Yeah, so I take this charge very seriously. It's been a while. The bathrooms have been redone. It's the first thing you notice when you get here early. It's like, wow, it's up tech here. So anyway, that said, I have been very blessed to have worked alongside this body. I started my county career with the Office of AIDS in 1996. So it's been a few minutes, right? I currently work at the Department of Mental Health. We're going through a huge departmental reorganization right now. I hold a fancy analyst title. Basically, I work with I will be working with programs that specifically focus on forensic psychiatry, things like juvenile justice, juvenile courts, halls, things like that. But there are so few of us who are recognized professionals within the health and human service field, and I'll mention that our panelists will speak to that a little later, that I was tapped by Michelle to come here today, and I'm very, again, honored to be back here. I am alive today because of the work of this esteemed body. I have lived with HIV for 33 years. It's easy to forget. It's easy to forget, and I don't want to say it this way, but perhaps take for granted the gains that have been made in science, in advocacy and policy that have benefited me. And I thank you for that. So anyway, you know who I am. If I can just pass the torch along to the other panelists so you can get to know them. By the way, I'm Navajo Indian. I come from New Mexico. I've been in LA for the past 30 years.
Hi, my name is Leland Morrill. I'm Navajo Dene on my mother's side. I'm a Navajo citizen, and I'm also Santo Domingo Pueblo Kiwa on my father's side. And my mother's family is from Arizona, and my father's side is from New Mexico. And I have been an activist since the late 80s, and I was just discussing with Cheryl up here, who helped get us here today, and helped us through the email process and everything. But I was discussing with her that I remember, I'm a transplant here to Los Angeles, but I remember back when there weren't a lot of these LGBT centers. And I remember when we started the Stonewall Center, I came from Salt Lake to here. I remember when we started the Stonewall Center, I don't know exactly how it got that name, that it was in Salt Lake on 3rd West in 1991. And we started with one of these tables and 3 folding chairs and a black telephone that was one of those dial phone. We showed up one Saturday and we didn't know what the heck we were doing. And so we just kind of like reached out to the community, and that's what we did. And now we've come this far through these 2 other generations now, to now where we're sitting here in this beautiful room with this esteemed group of people that are here as our commissioners, people who are very learned people, and also community members here. And so I'm very thankful for that. I have also been diagnosed with HIV on May 1st, 2002. So I've lived with this for quite some time. And I have also been a recipient of the LGBT Center, and also through APLA through the Red Circle Project. And so I'm very thankful that our community has also weaved itself into the greater community here in Los Angeles. And I have, like I said, I've been an activist. I've also, I don't know if anybody else remembers going to Sacramento a few times on those buses to go up to the Capitol to have our signs and stuff like that. Some of us went to DC and did the same thing, and some of us marched the streets along from downtown to Sunset and Santa Monica, and ended up on Vine, and anyway, it's been an interesting life. And so, but I'm thankful that I'm able to have a renewal of my life from 2002 on forward. But I'm also thankful that we do have the Red Circle Project, which is part of this, which is part of the greater body here. Thank you.
No toca Gabriel Estrada. My name's Gabriel Estrada, and through Chicana Generation and Raramuri and Chiricahua Apache, through Chicano Generation, I am Kashkanawa from Zacatecas. So I've been positive since 2003, and I tested through the Indian Health Center in San Diego, and then moved up to LA. I got a job teaching at Cal State Long Beach, Chicano Latino Studies and American Indian Studies. I currently teach religious studies at Cal State Long Beach. And I've been very grateful that there were programs like Red Circle Project, through AIDS Project Los Angeles. APAIT has also stepped in to create an Indigenous Healing Circle that's been very beneficial. And I do writing on media, HIV and Indigenous issues in the Western Hemisphere. So I'm glad to be here and share some of our community experiences and some of my own.
Thank you. I would like to acknowledge Cheryl. Thank you for inviting us. It really means a lot that we have this opportunity. I think you mentioned that in your packets you should have some information. I don't have one of those packets. You might. There should be something in there, maybe a fact sheet or two with statistics around incidents of infection and perhaps other things that you might want to scan. So, this discussion is aimed at informing your planning and priority setting and resource allocation discussion and process. We would like for commissioners to think about how this discussion relates back to service standards development, membership recruitment, and retention, and public policy. Thank you. Wow. Okay. Yes, you do have information. Okay. I wanted to mention that thanks to Leland's good detective work, you should also have received or will receive a link regarding a resource called the Red Pages, which is updated on a yearly basis by one of our service organizations, United American Indian Involvement. So you will also have access to that. I don't know if it's a web link or a PDF. It's PDF, okay, so you will have that as well. So you have that as by way of background. As Leland said, we want to underscore, we aren't going to give you the whole, everything you ever wanted to know about Natives, but we're afraid to ask kind of perspective. There's too much to discuss. But it is important, as Leland mentioned, to acknowledge that we are on stolen land. We're on land that used to belong to the Tongva and in some of the outerlying areas, the Chumash. So I'm very aware of that. We're as a Native, as Dene, as Navajo, I'm very aware when I am away from my tribal land what that means to me. There's a huge Pan-American Indian population here that I'd like to also, when we talk about barriers and challenges here, for our panelists to address from a personal perspective. So we are a small but mighty community here. And give you an opportunity during this process to find out more about who, leadership here, resources. Here's some different voices and perspectives. You see before you 3 men. I identify as gay. Some of us identify as gay, two-spirit, etc. But again, we hail from different life journeys, and we'll do our best to represent those that are not here, like Storm, Michelle Enfield, Elton Noswood, who has been very instrumental in providing avenues for support for us through Low these many years, and all of the service organizations that we're connected with. So as we understand it, the HIV/AIDS Commission is charged with listening to community needs and issues and learning from the communities most affected by HIV and respecting their leadership to develop sound programs and policies. Again, we're a small but mighty community. The incidents on paper, I'm quite accustomed to looking at those fancy-dancy pie charts where we're represented by but a fingernail sliver of color, 0.00, blah, blah, blah. But we are disproportionately beset by absolutely every social ill, every economic challenge that you can imagine, and certainly that extends to health disparities and especially HIV infection rates. So, framing the discussion thusly, I'll just ask a general question of you both. This is kind of awkward. let me turn this way. We're old friends. We're used to just hanging out. So this is to either of you, however you want to formulate your response. Could you describe the Native and Indigenous communities in LA County from your own perspectives?
Okay, from my perspective, the Native community, it also involves all those people that are brown that were born in the Americas. There weren't borders that were here. And so, and this was, Los Angeles was part of Mexico, or part of Spain. And so there was no border here. So even though I'm Navajo, we all, my family came back and forth to the coast, and they traveled back and forth, and they went on the boats out to the islands. And so this I know because my uncle and my grandfather have told me this. And so we're all connected here. And but also within that same aspect, our community here, we're a whole hodgepodge of very different tribes and very different nations. Some of our families came here under the relocation program, where the U.S. government relocated our families here. My family came here 3 times. The first time to Azusa, the second time to Santa Monica, and the third time through to South Los Angeles. And each time they returned, and so, and for punishment to them, the children were taken. And so I was taken as a child and adopted into a white family and removed. And so we went to Canada, and I ended up coming back here because I worked for the Federal Reserve System. And so I ended up here in Los Angeles, which is where I really wanted to be in the first place, not knowing that my Native family had been here 3 times. But also in that same vein, when the relocation program came here, they came here to assimilate Natives and to take them away from the learning from the elders and from all the different traditions and everything else. And so in that perspective, there's a discord between those that live in the cities and those that live on the reservation. There are the different ways that we live here versus the different ways that they live there. And different things are shared and are not shared. And so also when you look from that perspective, our traditional way of living is different for those that live in the city versus those that live in a traditional way on the reservations or in the pueblos like my father does. And so different information sets are shared and are not shared. And so I look at that from that perspective. And then also when we educate, then we also have to keep into mind that there's historical trauma based off of these things. And so, and we have to hear we have to understand that historical trauma exists, and that we have to be cognizant of those things, because that can shut somebody down. And even though you may be talking like this, they're not hearing anything once they're shut down. And so we need to be very cognizant of that as well.
Thank you. Would you like to speak?
Yeah, I think the community is complex because we're coming from so many places. We, for example, had Indigenous Pride Los Angeles, and part I see Gabby here through APIT and sponsorship, and we had so many people come, the Kanaka Maoli, Hawaiians, obviously American Indians, but also Indigenous peoples of Mexico and Latin America. I think we even had some African Indigenous peoples, so as part of, the community. So it is very complicated in that we're so large. Although I was born in Fullerton, I moved away and came back and did some schooling at U of A in Tucson. And the community there was different because I could ask people, you're either Yaqui or your grandparents are Yaqui, right? In the place that I lived in Tucson. Here, there's so many different kinds of people, and we're still getting to know each other. So there are those generations that went through relocation programs. There are also people like my own family that were refugees of different genocides in Mexico, revolution, continuing on. There are certainly Maya population here, for example, that escaped genocide. About 100,000 people were killed in Guatemala in the 80s into the 90s. UN found that the government was trying to kill off that Maya population. There are big immigrations now from Oaxaca with large amounts of Mixtec other Zapotec, New Savi. There's different names we have for our populations. But that's also been the largest numbers of indigenous people to migrate, which also brings us to issues of immigration, right? And how do people reach out and seek health care when they're afraid to go outside now that we have a federal administration that is targeting through ICE immigrants. So, but at the same time, a lot of us hold traditions of healing that are indigenous. We're used to going to indigenous practitioners. And so, programs like Red Circle Project that were developed through AIDS Project Los Angeles are very important because it allows for us to gather and to reinforce each other, to support each other, but also there's that cultural knowledge of who we are. So for example, one thing to identify as is Two-Spirit. We have many different names. I could say Mashochit in my Nahuatl language. There's Natle in some forms of Chiricahua Apache, and Nawi or Ramuri. But all these have to do with people who are between genders in different ways. So actually, sometimes I will check male, and if there's male and female, but if there's a third option, I will check gender queer or other gendered. So I know we don't have our trans woman representative, I suppose, was going to be here to talk more about that. But that's also an important part of our communities, is that in our traditions, we have different genders, sometimes 4, sometimes 5 or 6 or 7. That's normal for us, even though through colonization, through the Catholic Church, through Christian churches, through different states, we've often been forced to relinquish that knowledge, and we may face even prejudice within our own families at this point, depending upon how traditional our families are. So, the medicine that we talk about isn't just pills, it's also knowledge of our gender system, our cultures, our language, our family, our kinship system, and the way that we're related to land. So of course we acknowledge the Tongva Gabrielino of this land, and that there's a continuing presence and healing that's happening. But in doing that, we also acknowledge our own nations, our own cultures and languages. So I teach Nahuatl at Cal State Long Beach as an example of part of my effort to teach about gender and culture and so forth. But all our languages are important. And so I think through the federal funding, we have Alaska Native as part of the funding, and also Kanaka Maoli, the Hawaiians, in addition to American Indians, right, in some forms of funding. And so, for those of us who are not enrolled, right, who are reclaiming identity, I identify more as an urban Indian and transnational Mexican-American Indian, it's important to have spaces where we can be welcomed, and maybe we'll find more cultural fit in one area that's indigenous than we might in like a Hispanic or Latino environment, although those can be modified too, right, to serve different kinds of people as well. So I think, in terms of the generations that are here, there are some American Indians that come from American Indian Health Services they found were maybe lacking in some ways, or that seemed too intimate. They were afraid of being known to take medications, so people actually have come to our community here to receive better medical health, or different medical health, or to be more anonymous perhaps, right? So also, one thing Elton Nuss would say is that we have knowledge bearers that sometimes pass away. So it may not seem significant, like Tasha Faye Rose passed away several years ago, a trans Navajo woman who was between homes, and but she was fluent in Diné, Navajo language, and she was somebody who was helping me as I began to go on meds 5 years ago. So the loss of one person culturally made a big impact, because she was someone who really knew the language, ceremonies. Some of the trans women have great knowledge, for example, from different nations who are here. And the fact that they are trans often speaks to their tradition, right? That they allow themselves to present as Natle or as the different genders, feminine genders, because of the strength of the culture. So, it's devastating to have had somebody pass away just about every year. It seems like we have someone in the community pass away from HIV/AIDS. And that difference in medical system can also be problematic in that we may not trust the hospitals because we have a different healing way, or people can't afford to go, right? Some people may go with HIV in the most advanced stages when it's AIDS, get diagnosed late, and then pass away soon. We also have different, I guess we'll get into this later on, but a barrage of different other comorbidities, right? Drug addiction. So if somebody is between homes, living on the street, and an addict, and positive, and all this is a result of the historical trauma of colonization, the ongoing settler colonialism, then that creates a situation where it's very hard to get the help. And I did see some of the stats that a minority of people, of American Indigenous people who are positive are actually receiving care. There's a whole cascade of care that you're so aware of, but that's especially true for Indigenous population because of that disconnect between a state entity, including the health system, and Indigenous populations in the ways that we've been experimented on, or underserved, or misunderstood, or judged by the establishments that are, including the health system. So we do need culturally appropriate forms of HIV and AIDS prevention. I guess we'll get more into that in a little bit. Yeah.
Thank you. Well, to ask a follow-up question, and you mentioned a lot that we'll touch upon later on in various questions and comments. This is to both of you. What are the assets and strengths of our American Indigenous communities here in Los Angeles? What are our assets and strengths?
One of the assets that we do have is we do have UAII, which is United American Indian Involvement Center, which is just up on 6th and Bixel here. It's close to downtown and close to here. And there we have an IHS, which is an Indian health clinic there. And so we can direct people, those that are within the Native community there for care. And from there, they know that the Red Circle Project exists under APLA. They also know that APLA and the Gay and Lesbian Center and the AHF organizations are here. And so I'm sure that they can easily refer people to them. But also, within the whole system, we used to have a Red Circle Project powwow. This year we're not going to have one. I don't know the reason why, but that's really something that is kind of, I would say, upsetting in the fact that it's a gay and lesbian, transgender, Native American powwow that's usually in West Hollywood in Plummer Park. We're not going to have that this year, and that combines so many different people who within our community. It has been over the years, and Elton Naswood started it through Red Circle Project. It has been throughout the years a way of connecting communities together, and those who are HIV positive, those who are affected by HIV, those people who want to learn about it, those people who want to just be there as a community organization to celebrate the community, and they understand the reason why that powwow exists. And this year we're not going to have it, so that's one of those things that I wish was going to happen, but it doesn't. But it has been a really great asset over the years. And also, the Red Circle Project has been a very good organization to have to connect to Native Americans in the past. And so, in fact, so one of the things that I do when I'm volunteering downtown is usually on my way to work, on my way home from work, or sometimes on the weekends, is I make sure that I look for Native Americans within the communities who are housing challenged, who don't have housing, or are living on the streets, and I make sure that they go to IHS. I'll even take them on the bus with me, or take an Uber or something like that over to UAII, just to make sure they get their services that they need. And we have one trans woman who's a Ute that's also on, that used to be part of our RCP members that always came to the meetings early on, and she no longer attends, but she's also housing challenged and funds challenged, so she's not able to get the resources sometimes. And so to get her to the Red Circle Project, to get her to APLA way over on the west side on a bus when she hasn't bathed, she hasn't clothed, she hasn't, she doesn't have all the things that we take for granted that we have. She hasn't eaten. She hasn't, sometimes her medication gets stolen, and so she has to have, that care, and she's now seroconverted over the years, and so now it's really one of those things that we have to start looking for. And I'm sure within every community there is, there are other homeless people that are from every other community, but to me, to watch her over the years, I've known of her since about 2009, and so I've been watching her life as she's lived it alongside of my life, because I see her most every week, and so to see these things. But the asset is that IHS is right within walking distance. She can walk across that bridge on 5th and get there to the Indian and to the clinic. And so, but the barrier that she has is going all the way to APLA, which is over in the Crenshaw district. And so it's very far for her. And so that makes it very tough to try to get her to go there sometimes. But also there's another thing that's also there. We have AA groups that are downtown, one right on Broadway, just north of, I work out at Planet Fitness, so it's just on the north side of that building, and it's called the Share Program. And so and it's a safe place for her to be. And so she goes there quite often just to hang out and just to be in a safe space. And so those community programs that we have that help them with alcoholism and with drug addictions, they need to, be honored within this group as well, because they help us. And so that's what I want to say.
Before I ask you the same question, Gabriel, I just wanted to clarify. Hope you're taking copious notes. We babble all this out as if we know, think everybody knows all the acronyms, our world. We want to invite you into our heads and hearts. One thing I wanted to point out was IHS. Does anybody know what IHS is here? Okay, thank you. Right. So those of us in Indian country, we know that acronym well, and it can be a charged reaction that we have to it. We have a compact with the federal government to provide these services. I know back in New Mexico we have IHS hospitals. I was well acquainted with them growing up. My family, we would go to these, but there is a charge around these and the cultural competence of the delivery service of IHS, as well as the access to services. So, anyway, I'll ask you this question again just to refresh, Gabriel. What are the assets and strengths of the community, in your opinion, from your perspective?
Well, we do have different programs. Red Circle Project. I mentioned the APIT, Indigenous Healing Circle. We did have the powwow. Many people have seen there's been a shrinkage in funding, so that wasn't able to be funded this year through APLA. Seems like there's, an asset certainly is our culture. I still believe that. Even talking about our youth, trans woman is actually very knowledgeable about who she is. She's really funny. So some of the most knowledgeable people and culturally may be people who perhaps need the most resources, right? There's that real irony that the people that really we should be appreciating the most really have the most to give culturally are sometimes those who are facing the most amount of structural oppression, right? Or the most dislocated in terms of housing. So, it's the irony, right? I think we've managed to work with the community. We mentioned Elton Naswood, Navajo, who helped found Red Circle Project. And one thing that he did was to get the powwow going, or just to get Red Circle Project going to powwows. There are numerous powwows in the Los Angeles area. So Elton shared that at first people, they laughed. Why are you here? What are you doing? Right? There wasn't an acceptance, but over the years, things changed. And at this point, as an asset, we can say that through most of the health organizations, that LGBTQ, Two-Spirit issues are actually welcome, that people understand who we are now, and Native organizations are working with us. And with many of the AIDS organizations, there's also some understanding, but perhaps more need for programming to address the issues of Native, LGBTQ, and Two-Spirit people. So I think assets is that we have worked together. Also, the culture has changed in Los Angeles, so that at least some years ago, there were more Native organizations working together. There's more partnership possibility between organizations. So I think whereas perhaps there was once a time when different organizations were fighting for resources, and now there's an ability to partner. So I would like to see more partnerships happening with Native organizations and other institutions. Maybe there's ways of educating, like for example, we have Changing Spirits Recovery House in Long Beach, and I know that Michelle Enfield has gone, or others have gone from Red Circle Project to do work with the Changing Spirits to address issues of LGBTQ Spirit Native recovery, right? Because that's a big part of also of HIV is peer recovery status. So I think an asset is that we do have a community, an ability to work together across organizations.
Thank you. Okay, I'll jump to you in just 1 second, but I want to know, by show of hands, how many of you have been to a powwow? Wow, that's great. That's good. How many of you have no idea what a powwow is? Okay. Yeah, can you just kind of like throw out like a 2-second description of what a powwow is, either of you?
Yeah, I mean, it's a celebration, so oftentimes there's dancing. Often it's based upon plains cultures. So, and then people in migrating have brought the traditions here. And in Northern California, we had big time, right, for California Indians. There's other kinds of gatherings for California Indians, but this is sort of a diasporic celebration, oftentimes dancing, oftentimes there's now information booths, food, things to buy and sell. And they occur usually, when it's a little bit warmer.
For me, the powwow system from an urban Native experience it's a community. It's a community gathering of all Natives and all those people who want to come to the powwow. I mean, any one of you can come to a powwow and you feel just as welcome as I am. And so it's a community event. And also, the thing that I wanted to add on to is that the Red Circle Project has always been there with an information booth about AIDS, about PrEP, about HIV, and has had a trailer where people can get testing. So that's one of the assets that the powwows bring to our community as well. It informs the community, and people can come up to the table and take what they need, or just talk and stuff like that. And all of us within our community, we kind of know each other, and so we know what our comfort level is with each other. And so just that camaraderie and to be able to have those powwows happen. Sometimes they happen during the summers, like every weekend or something like that. It's like you sometimes have to fight over which powwow you're going to go to, because sometimes there's two that overlap, and so I'm going to go to this one in the morning, and I'm going to go to this one in the afternoon. But you're always cognizant as a community member, a Native community member, what's happening. And at each one of those powwows, there's usually some type of representation for AIDS, HIV, healthcare, and information through the Red Circle Project. And so we're thankful for that. So it is a great asset to have the powwow structure.
Thank you. Did you want to follow up? I think you mentioned something else.
He did.
Oh, did you? Okay.
Yeah,
Okay.
and I can just mention a shift from earlier years, like at Cal State Long Beach, there was Lester Brown, who worked in American Indian Studies, who actually had meetings in the early days of AIDS, but because there was so much stigma, which is another question that's coming up, people met in rooms that were rotating, like secretly meeting, right? So we've gone from meeting in secret rooms that were rotating, very anonymous and somewhat fearful, to being able to present ourselves and HIV issues out and fully in the community. So that's been a lot of growth in the past 2 decades, three decades.
Thank you.
I also wanted to add something. The Red Circle Project, when I started going to it under Elton Naswood, this was about 2009, 2010, it was when we had the HIV meetings, the community meetings under President Obama, when we were organizing those things. That's when I met Elton Naswood, and so that's when I started going to Red Circle Project. And at that time, it was over here close to Vermont, or was it, or Normandy, just off of Normandy. That particular metro station is what I used to take to get there. And there's a building, a 4-story building there. I don't know what that's called.
It was over at the APLA office on
Yeah.
Wilshire, near
Yeah.
Kingsley, I think.
Yeah, on Kingsbury. And so we used to have the
Thank you.
meetings there. And so it was, there were a lot of people that would attend it. You know, people would come and go and stuff like that. And it was great to have those. But for some reason, those meetings have deteriorated, and we don't know the reason why, but we just kind of I think the focus went, you know, as time went on, just kind of veered to a different way. And so I just had stopped going. And then I'm sure that other people stopped going because now those meetings don't exist. And that was also something that was an asset to us because we could connect the generations, the younger people and the older people. I'm not younger, I'm older now. And so, but when I started going, I was in my mid-40s, and so now I'm in my 50s. And so yeah, so I mean, so to connect to the different generations of people that are affected by HIV and AIDS and stuff like that, and the queer people or the two-spirited people or the however that you identify, it was a great thing to have. And for some reason, those meetings don't exist anymore. And I remember when I graduated from Brigham Young University, and so I remember we were friends of Dorothy, or we were musical and stuff like that. And you know, I remember we met across the street at a Utah Trade Tech at the time. It's now a college, but in a room there, and BYU security was always hunting us down. So I remember and writing our names down of who attended and stuff like that. And so I remember those days, and we've really come a long ways. But to have a meeting stop for reasons that I don't, you know, that are different because of a change in focus, I think perhaps those meetings really need to happen again, because I think that they really connected us as generations and as people. And so that's for me as a community member.
Thank you. An hour goes by quickly, and I do want to allow a robust 15 minutes at the end of our session here for you all to ask questions and to do follow-up. Moving into the next area, stigma. You mentioned, Gabriel. Stigma in Native and Indigenous communities can be a debilitating barrier preventing someone living with HIV or at risk from HIV from receiving healthcare services they need and deserve. What ideas do you have that could help our community and public health partners address barriers for Native peoples to get HIV services or information about HIV prevention?
Again, the meetings that we had at Red Circle Project, I think, are really key because they bring people who are HIV negative, for people who would qualify for PrEP, and for people who, you know, we can keep those preventative things from happening so they don't seroconvert. I really think that is a very key thing, because to have that open discussion where there's no judgment between the people. Sometimes the discussion wasn't even about that. It was just there being present. And to be just there, it's like a homing area to be. And, you know, and then when the discussion, I mean, there was always a reason, you know, a subject to be there, but it just wasn't, when you went, you could either say what you wanted to say or just, you know, not say anything at all. But just being there as people, I think that's really key, is to be present in that moment and to be able to have that time. And then when you do have a question, you're comfortable with stating your question, or if you have something to say, then you can. And so I think that those meetings are very key to have, and we're really missing out on an opportunity. And also, how many people have seroconverted because they haven't been to those meetings or don't know of the information or know the latest update. And if we keep on saying prep to these people, they're going to get it at some point. But if we don't have those meetings to be able to do that anymore, they're not going to hear that message anymore. And so that's something that we need to focus on too. And so.
Okay.
Yeah, I would say to fund Native American Indigenous HIV/AIDS programs. So I guess there's a hierarchy, right? The idea would be to fund the program so that it can do what it needs to do. If that's not possible, it's also possible to get training so that members of the organization know who Indigenous people are. What is a two-spirit person? What are the different genders? What are the different languages that we have? So I was a co-founder of the City of Angels Two-Spirit Society, CATS, and one of the current chair, Hudson Tibbetts, is a nurse, but also does training in the hospital system. Who are Two-Spirit people? What is a transgender Native American, right? So to understand who we are and to have programming to staff, right? Native Americans, to have people who know the culture, who can relate to the different populations, reservation, off reservation, is important. So, a program, or at the very least training, and all those things can help save lives in the Native community.
Okay. And related to that, how can the commissioners advocate for increased HIV and STD testing and access for healthcare services?
I think that within our power structure, we have that kind of built in now, but continued funding and continued awareness and updating the pamphlets that are given to the Red Circle Project, and perhaps more of the stories. I mean, I remember it was Kenny Ramos. He did a whole segment of different stories that he had made into these pamphlets. And so it was the different things so that they were like trifold things that you could carry in your pocket. And they basically told of your experience with HIV, and it could either be an HIV positive person or a negative person or whoever it was that they interviewed. They just asked for it to be interviewed. And so that type of information, it also brings in a community member's perspective of this. And so when somebody, a layperson or a community member, just takes it off the table, like, oh, this is somebody's story here. And so that makes it a very personal thing to them. And so I think it's a really good tool to have that type of thing, and to have continued funding for stuff like that communicates you, because I mean, we live in a world that's like this. This is our world right here. We're like this. When I came down off the subway today, I went down to the subway. I had to go around people who were coming up the stairs going like this, and I had to weave my way through. This is the way that we live now. And so to create tools that we can integrate this with, but also tools that people are used to holding things that are this big. And so if we make the pamphlets that big, I think that would be a really good tool too.
Did you want to?
What was the question?
Okay. The question again is, feeding off the idea that there are barriers. How can we increase HIV and STD testing for our Native populations and get better access to health care?
Okay. Yeah, I mean, I guess it'd be great to have the powwow back, yeah, where, we do gather as a community, and we do have testing there to be present in other powwows, to work with Native organizations, UAII, other organizations. All those things can help. And I was just thinking of that campaign, and they were also on the bus. I mean, it was great to walk around LA and see, on a bus, a Native person's HIV story. And to strike the invisibility of Native people in Los Angeles. Los Angeles has the number one, greater Los Angeles has the number one amount of American Indians in the nation, right? We are the center of American Indian populations. So it's ironic that we would have so little funding for the population.
I just want to throw out something. I am not a programs wonk anymore. I work behind the scenes, mostly in budget and contracts formulation and monitoring. In the Department of Mental Health, we have funding streams through the Mental Health Services Act. One of the plans of that act focuses on prevention and early intervention. We're going through, as I mentioned earlier, a huge departmental reorganization. And as part of that reorganization, our new director, Dr. Sharon, has made a pledge to get more partnerships going with communities. So there is a golden opportunity. Some of you might know about MHSA PEI, it's called Prevention and Early Intervention, dollars. And they will touch all communities. Certainly this is one other possibility of partnering, and maybe braiding funding that will support health and wellness, the infusion into health neighborhoods, and something that could, is especially needed in our community. So I just want to throw that out there. Let's move on to something very specific, and then we'll open it up for plenary discussion. Through your work experience in your various purviews with our Indian, so-called American Indian community, very large community, through your work experience, what is the level of knowledge and or awareness of PrEP, pre-exposure prophylaxis, post-exposure prophylaxis, treatment as prevention, TASP, and undetectable equals untransmittable, U equals U, among Native and Indigenous communities. Also, if possible, can you comment on how sexual health is viewed in Indian communities? It's a big question, I know.
I'm going to start out with, I know one young person in their 20s that is Native, that is on PrEP. And they specifically messaged me about it one day, I didn't ask, they just did. And I thought that was great. And I think part of that is because of, our continual making sure that the POWs have the information and stuff like that. So I think that's really a great thing. The barriers are like the homeless population. Some of the natives that come here, they're not well equipped for a good job and to be able to get housing and things like that. And a lot of natives started out as homeless people and then ended up getting housing later on and getting their jobs and stuff like that. And so I know several people that did that. And some of the trans people did that as well, and that are native as well. And so it's a challenge if you don't have the resources, and if you come from a third world country such as the Navajo Reservation, then coming here, you have something better. In fact, one of the guys who's Navajo, who's on the streets right now, I bought a bus ticket to him back to go to Gallup in New Mexico to be home, and then he ended up showing up the other day back here, and he said the services here are better than they are on the reservation. And so the health services, he couldn't get the same health care as he could get here in a large city. And so, but the thing is that he's still homeless, and the only way that he'll go to see somebody, because he doesn't trust people, he's got that trust issue. And so I will go with him to UAII to go to IHS, to the clinic there. But I literally have to sit outside and wait for him that entire time. And so I don't know if there are other people that do that as a job or anything like that, but that's my time, and that's what I do just because I'm a person that just happens to see them. And that's it. And so I'm sure that there are other people that do the same thing within our Native communities, but that is a barrier. And so when you don't have the funding and when you don't have the trust of other people, but you know that the healthcare here is better than it is where you came from a third world community.
Thank you. So Gabriel, just to restate, we're a new content area for me, along, water under the bridge. I haven't thought about HIV, I take this knowledge for granted. Now we have all sorts of information and treatment related to PrEP, post-exposure PrEP. Do you know how this is penetrating, if this information or knowledge is penetrating our community? And also, if you want to comment on how sexual health is viewed in our Native communities.
Well, speaking of penetration, it varies a lot, yeah. And
Levity is allowed.
I'm thinking also in terms of who we have sex with, right? So, and specifically for some Mexican Indian populations, it can be norm for men to not identify as gay, but have all kinds of sex with men or trans women, right? So there needs to be culturally specific ways of looking at educating people, different languages. So I think everything's changing so quickly. Even I, who am looking for the information, have a hard time establishing U equals U. I can't transmit the virus because I'm undetectable. That's taking time to sink in, right? So, and I know that if it's new for me, that for a lot of people it's unknown, right? I tell people in the POS community, and people still don't know what that is. So, and that makes a huge difference in terms of stigma. If we knew that, our stigma would be so much, if that was true 30 years ago, if we had known that, stigma would have been so much less, right? So, yeah, there's a world of difference now, but nobody knows it yet. Yeah, our society doesn't know it yet. So we have a lot to educate in terms of that, especially in Native community.
Thank you. Time does go by quickly. I'd like to open the floor up to the commissioners here and or audience to ask us any questions or follow up on comments that have been made.
Okay, so if you would like to talk, just put your card up and then we'll develop a list. So Kevin, go ahead.
Thanks so much. It was really good to hear from your community. On that note, putting my operations hat on for a second, my ex-operations hat, it'd be good to have a representative from the community on the commission. We haven't had that since Michelle left, other than Jason, so we'd welcome someone to join us, I'm sure. I wonder, in a couple quick things, understanding that there's some mistrust about privacy and all of that, is there something in IHS like HIPAA, like we have with our health service? Are there privacy guarantees within your system? And then is PrEP available through IHS? And are there distribution places that you can get that in the community?
I can only speak generally. You know, you touched upon a very interesting issue, Leland. You know, in Indian country, and you referred to, like, especially our tradition as being a third world country, I know that services are so few, and there is a confidentiality issue. I mean, even though HIPAA is assured, right? IHS is federally governed, regulated, et cetera, and is, you know, subject to all of the HIPAA regulations that we all know here in public services. I know that there are people who are probably loath to use those services because they don't want somebody's cousin or aunt to see them going into such and such office. And hence, this is one of the reasons that people do like coming to maybe a more urban area where you can be a little bit more invisible, right? So there is that issue. I don't know about PrEP. I would think that there are, I would hope that there are, but I can't speak knowledgeably about whether or not there are all these protocols and treatment options available in IHS formularies and medical care. I do not know that.
Okay. Questions?
Can I
Okay.
say something about that too?
Yes, go ahead,
I honestly have not, I don't know of anybody that's gone to UAI, to the IHS clinic there, to like for PrEP or for HIV care. I myself am an assimilated Native, I'll put it that way, because I was adopted outside of the nation. I seroconverted, and here in Los Angeles, and it was under my health care plan. So I went through just a private physician, and then when my T cells went down, then I went to Glendale Memorial Hospital for that. But I honestly don't know about that. But I do know that the healthcare system, even here in Los Angeles under IHS, we all know the people who work there. And so that might be a barrier from that perspective. But I think the referral system and to the other ones, that would bring the anonymity that might be welcome for that. And so, I mean, I myself go to the LA Gay and Lesbian Center for my treatment. And the reason why I go there is because I could not find private physicians who were willing to listen to what my needs were as a person and as a gay male. And so I gravitated towards the Gay and Lesbian Center because I needed a physician that understood what my sexual practices were and the way that I live and what I need. And so the doctor that I have there has been very good about cataloging my family, about what my health requirements are, what my traditional health requirements are, even though he is not Native. And so I think that's really, really a good thing to have. And so I feel really blessed for having that. And so as far as the HIS, I honestly don't know, but that might be a good discussion because they also have booths at the same powwows as the Red Circle Project does. And so that would be interesting to find out.
Great. Okay, so we'll take Susanna, and then after that I have a question. Put your cards up, and then we'll go to the audience if they have if they have questions.
Thank you. The information was really great, and it was really good to hear your insight and your personal stories. I do have a question about what resources or services are available here in LA County that for Indigenous communities living with HIV that come from places like southern Mexico, Guatemala, and Peru, and Spanish is not their first language.
Yeah, I think that's a tough one because, and I haven't really worked with like Bienestar much. I know that like there are organizations, like I believe there's a Mushe organization that has worked with Bienestar, which is from Oaxaca, right? So these are Zapotec. So yeah, that can be an issue when the assumption is that everyone speaks Spanish, but then a lot of our, like our elders, for example, indigenous communities maybe do not, right? Or they prefer in their indigenous language, so the kids have to translate for them. But if there are no kids around, then they're not getting the information. And if they're having sex without the kids around, then, you know, they're not getting information. So I think that translation issue can be, that can be hard to deal with because there's also so many languages, right? We don't all speak the same language, or even in the same language family. They're really actually diverse. And it may even be that, like for Zapotecs, if one parent is from one village and the other one's from another village, they don't speak the same form of Zapotec. So they speak in Spanish to each other, or maybe English, right? Or so there's also erasure of identity. So I mean, I have classes where I have students talk to their parents, their grandparents, you know, who are you? Sometimes they realize like, oh, I didn't realize that my mom spoke this language. So between generations, there can be great cultural loss because of the fear and stigma of being indigenous, right? The parents may not want their kids to know very much, when actually there's a lot of power about healing, for example, in these traditions. So yeah, that is, it's an ongoing issue of language and the diversity of our languages, right? Yeah.
Thank you. So if any other commissioner has a question, okay, Felipe, I'll ask my question and I'll go to Felipe. And then if anybody from the public has a question they'd like to ask, please just, I guess, flag us up here. The question that I have is, you speak of indigenous practitioners, indigenous medical programs for the communities, Native American communities. What do those look like and how are they different than traditional practices that we have in Los Angeles?
Well, I mean, for example, we had a medicine wheel model that Maddie Jim developed, Navajo from New Mexico, I believe. And so it's like directional, the 4 directions, and we all have our different directions that we have, east, north, south, and west, right? So, but, you know, kind of in translation, what we could agree upon is that there's a spiritual aspect to healing that comes through our spiritual traditions from our grandparents. There's, you know, physical knowledge that we had to learn. What is HIV? What's a virus? How do we contract that? How do we protect ourselves? There's emotional issues. So having, being a two-spirit person, how do we deal with that in today's society where that is not understood well, or through you know, colonization have lost access to that knowledge, or you know, just being out in the city, outside of a traditional area, how do we deal with people who don't understand what those genders are, right? So there's an emotional aspect, and then the mental aspect too. You know, how do we think differently? How do we educate ourselves? So I think it's a lot more integrative and holistic, but there are some things also that we may not be able to do in the city. We may have to go back to our pueblos or reservations to see a specialist, or maybe there are people here who can generally ask questions, you know, in an urban area, but it may require travel, right? And that's something that other people don't probably have to do in the same way as indigenous people may have to do. So yeah, these are involved with our creation beliefs, how we're created, our sacred mountains, for example, our sacred mountain, places that we may have to visit, and they're site-specific and culture-specific. So I can't speak to everyone's, you know, but I know that we all have like a land base to which we will often return for the sake of healing. And that isn't required for many other people in the same way.
Thank you for mentioning that. I haven't thought about this too. When I first tested positive, I went back to New Mexico for a blessing way, for a healing ritual for my HIV infection, as well as getting my AAA from Kaiser. So, it's a balancing act we have. But I also want to say real briefly and not hog up time that I look at things from a funding perspective, Al. There are funding things like the aforementioned PEI funding, United American Indian Involvement. Dan Dickerson, who's a researcher and a program specialist, helped to develop drumming circles that provide cultural supports, especially for young men who are addressing substance use and addiction issues. So there's things like that. Much of what we do is dependent on funding sources that are creative or expansive enough to allow us to do the integrated sort of work that needs to be done. You mentioned American Indian Changing Spirits, right? A drug and alcohol program that incorporates culturally competent and specific ways. But we're from so many different tribes. We kind of like patch things together as best we can using existing resources and programs that are funded and allow for such work to occur.
And thank you for that answer that you provided. That was so fascinating to me and helpful. Felipe, you had a question. And then, if there's anybody in the public that has a question, we have a couple minutes. So raise your hand, so we'll get you. We'll go there next. Go ahead.
Yeah, I believe that there is a large or medium-sized community of indigenous people from southern Mexico here in LA, specifically speaking about the area of Alvarado and Olympic around there. I wonder if there is any organization that is reaching out to them to let them know that there is help for people who are HIV positive, that there is support for them, that there are services available to them, or they're invisible to the whole system, to the whole health services departments that we have in LA.
Yeah, I can't speak authoritatively on that, but I know that there would be issues. There can be issues, obviously, of documentation, right? So there's the fear of getting services. There's also poverty issues, also gang issues, to be honest, right? I mean, if people are not getting access or afraid of being in educational systems, then there's the underground, right, workforce, right, which could be selling this, that, or the other thing. So I think there are issues of invisibility within so-called Latino populations, but in Mexico, it's not just 10%. I think it's 20% of the population identifies as indigenous, and 10% come from households that are speaking indigenous languages. So it's a greater population than what we might think that is migrating here that could be serviced through indigenous geared programs, right? But the trick is how to outreach for that. So it should, I mean, I know UAI also takes people who are federally enrolled into some programs, but also opens up to non-enrolled people in other programs. So it's great to have the flexibility of enrolled, non-enrolled, and that should be followed out. I don't want to speak for Bienestar, but they might be a key people to kind of field that sort of question as well. So maybe some of you are from that organization here.
Yeah, because I would think that, for example, there is a society of people from Oaxaca, right, or from Chiapas living here. And then if there is any way or there is any form that they could contact like the leaders of those organizations and ask permission if they could at least place a flyer there, just a flyer where it says, if you need assistance with HIV or health, have any organization that you're aware of done that?
There's Frente Oaxaqueño Binacional, Indígena, so FIOB, I think is their acronym. So there are transnational Oaxaca indigenous organizations. There's also the Mushes, right, who are famous for their velas. And in fact, there are velas here. A vela is a celebration, I guess for those who don't speak Spanish. So I would, if I was in an AIDS organization, I would contact the Mushe organizations and also contact FIOB, del Frente Indígena Oaxaqueño, I think it's binacional.
But do you know of any organization that is doing
I
currently
don't know
doing
for
that?
sure.
Okay.
No, I don't know
see.
for sure.
And also, as we know, HIV does not discriminate. So it's important to reach out to both, not only two-spirit people, but to cis persons, because a female may get infected by her husband or by vice versa or whatever, right?
Yeah.
And if they're invisible to us, then there is no way for us to help them. Thank you.
Thank you, Felipe. Okay, I didn't see anybody from the public put their hand up to ask a question. Last call. Anyone out there that has a question? Okay, Dr. Vallejo.
I wonder if you have any experience of reaching out to the casinos' monies to fund any activities for HIV work. If anything, somebody knows about this. Thank you. Casinos' money.
Casinos, so native casinos.
No, I mean, I guess there's some regional differences. So I think that were we closer to those areas, that there might be more of that outreach. But I think we're attempting that. We have attempted at times, but I haven't seen much forthcoming in my recollection of that funding. Perhaps if we were in Riverside or other areas.
I know we're kind of at a close, is that right? I did want to say two things have really jumped out at me, a takeaway for us, and then also a question for you all, at least from my perspective. One, having been a former commissioner, again, many years ago, one of many, Elton was a commissioner, Michelle was. This is one issue we face. There are so few of us doing the work, right? So developing that leadership, I mean, it's incumbent upon us to really kind of like find somebody to move the work forward and to be on this body to help consistently field these questions and get resources going and, that information flow. That's one thing that I'm going to be moving forward. Also, I wanted to mention I'm on the American Indian Mental Health Conference Planning Committee. We're planning on doing something this November. We're slating our American Indian Mental Health Conference. I think it'll be at the California Endowment, so you'll get an e-blast about that. So if you can attend that, please do. And then I have a question for you. You've heard Red Circle, Red Circle, Red Circle. Well, those of us who were founding members many years ago, it was a very exciting opportunity then. It was first under United American Indian involvement, and then it moved under the aegis of AIDS Project Los Angeles years later. And the mission has kind of like changed over the years, again, dependent on the funding, depending on the focal population being addressed through those funds, right? And then many of us, myself included, kind of like drifted off. Life got busy. It seemed that the mission got more specific to transgender individuals who absolutely needed services. But as was said earlier, everybody gets HIV. I got involved in work, etc. Many of us kind of like drifted away. But it was a central repository for information, social networking, information exchange. And I am just wondering, now that I'm kind of out of the loop, what is going on with that funding-wise for APLA? I've called Jonathan Talamantes, who is the now designated program manager there, to find out what's going on, because it was so central in the way of being a hub for us, bringing us together. And I really rue that it has kind of like been evaporating.
I want to say
Yeah,
that's where we all met.
Yeah, can I say, Mark, I think that that the folks from DHSP can probably talk with you specifically about that, like during the break after, because we're trying to respect the boundaries between what we are able to do as the planning body.
I hear you. Thank you.
So I'll let Mario and his staff deal with that during break. Okay. Or now? Do you want to do it now? It's up to you.
No, I just think it's important, Al, thanks for clarifying that we continue to appreciate that there's a lot of agencies that are part of our network who provide a lot of very valuable services. There is an expectation that there's a level of cultural and linguistic competency provided by our providers. We all We also, given the potential perceived conflict of interest, dissuade any agency-specific conversations or statements. And so I just wanted to reiterate that. So obviously, we have a long-standing and ongoing commitment to meet the needs of communities most impacted by HIV. But thanks, Al, just for making sure we draw a fine line between agency-specific conversations and our overall system and its responsiveness.
Yeah. I do think, Mark, that the PPNA committee and the other panelists, the PPNA committee that that is held monthly would be a good place for members to engage there to talk specifically about some of those issues. Okay, so then we're at the end of the panel. So let me just thank Leland and Gabriel, and again, thank you very, very much for being here. I want to thank you, Mark. It's good to see you after so many years back here at the table. And I am thinking about an individual that you probably remember as well. I know Brad does, but Michael White Bearclaws. Michael White Bearclaws used to sit on this commission from the early 90s, maybe about 1992, 93, until he passed away between 97 and 98, somewhere in there. Is that correct? It seemed to me like it was a little bit earlier, but I could be mistaken. But Michael White Bearclaws was a commissioner and actually did pass away while he was a sitting commissioner. And I think that he was a force back then that spoke a lot and educated us back then a lot about the issues. And I do miss him and remember him today because of your presence. I don't know if you wanted to say something about Michael.
He was all that. He was everywhere and participating with us and planning with us throughout the county and making us more aware. He was
So
a lost angel.
Yeah. His presence is here today. I feel him. So let's give them a round of applause for doing this.
Could I just add one more item, Mr. Chair? So I just wanted to thank Gabriel Leland and Mark for being here. You also mentioned a number of long-standing advocates and stakeholders, Maddie Jim, Alton, Michelle Enfield, who have been part of these critical conversations. I just wanted to further impress upon us the need to have the voices of the Native community at the table, as Kevin Salter pointed out. But I also want to make sure that we have multiple voices at the table from the American Indian Alaska Native community, because sometimes when it's just one person, they shoulder a tremendous amount of burden. And so if we can get a handful of voices to be actively engaged with the work of the commission, I think that would be pretty remarkable. So hopefully many more than one.